So, welcome everybody. My name is Ara Iden, and I am an intern under Change at the Cancer Center, and I will be guiding you through session 3, Overweight as Risk Factors for Cancer. So, please follow along on your participant manual like this. You've gotten it at your first session. So before we begin, let's briefly review session 2. So we went over 3 different types of breast and colorectal. We found that early detection and diagnosis leads to early treatment, and which leads to a better outcome. And we found out that screening tests are for a condition before there are symptoms, and diagnostic tests are for a condition after a person has symptoms. So let's look at page 2. So individuals who are overweight and obese have excess body fat. They have an unhealthy proportion of body fat and usually see abdominal obesity, which is extra fat around the waist area. So this excess weight around the waist is considered the most harmful. Obesity is considered to be a disorder involving excess body weight that increases the risk of health problems. So overweight and obesity contributes to as many as 1 in 5 cancer-related deaths. In fact, 20% of cancers are a result of that excess weight. In the past, smoking was the only major modifiable risk factor, but as smoking has decreased, obesity increased and basically come alongside it. So you can see how these statistics show that 50% of all cancer deaths could have been prevented with a healthy lifestyle. And that's why we are so passionate about what we do here today at the Change Intervention Program. So let's look at page 4. Being overweight and or being obese has been linked to as many as 13 different types of cancers, some of which we already learned about. So as we can see, obesity and overweight can be linked to breast, colorectal, uterine, pancreatic, and liver cancer, just to name a few. The Institute for Cancer Research estimates that excess body fat is the cause of approximately 130,000 U.S. cancer cases every year. So let's look at how obesity is linked to cancer. So studies show that in individuals with excess body fat, that there's an increase in insulin levels, which increases the risk of cancer. Also, excess fat leads to chronic low levels of oxygen and low-level inflammation, both of which increase cancer risk. And excess fat has been shown to produce higher hormone levels, especially estrogen, and this also increases risk of cancer. And research shows that fat cells may affect the way tumors grow also. Page 6. Now we know what overweight and obesity is, and we clarified what types of cancer they can cause. Let's determine how someone can be classified as being overweight or obese. So on page 6, you're going to see the BMI, or the body mass index, and the BMI is basically used to calculate obesity or calculate what category a person falls into. So this could be overweight, obese. So the BMI is calculated by dividing a person's height and weight, and this ratio is a useful screening tool. So on page 7, you'll see the chart, and I want everybody to take a minute and to just find your BMI. So if your BMI is less than 18.5, you are considered underweight. 18.5 and 24.9, you are a healthy weight. A BMI of 25 to 29.9, you are considered overweight. and a BMI of 30 plus is obese. So earlier I mentioned excess fat around the waist area is considered the most harmful. So let's talk a minute about what is considered a healthy or unhealthy waist measurement and how to measure your waist correctly. So for females, waist circumference or the measurement just above the navel should be no more than 35 inches, and for males, no more than 40. So basically, a basic rundown of measuring your waist is you get a tape measure, you stand up and you hold the measure on between the top of your hip bone and the bottom of your ribs. And then you bring the measure all the way around your waist, level it with your belly button, and try not to hold it too tightly. Make sure that the tape measure is straight around your back. Breathe normally, don't hold in your breath, and exhale. Now, when you look at the tape measure, check the number right after you. So looking at page 9, causes of obesity and overweight include genetics, behavior, hormones, diseases, and even treatment for diseases. Coupled with these factors, obesity occurs when there's an imbalance between energy in and energy out. And so we see this when we are eating more foods that have high fat content and we are not necessarily balancing out with physical activity. So page 10, we want the energy balance to be equal, where our energy in is equal to our energy out. So there are ways to change this energy imbalance and reduce your risk for obesity and being overweight. And this starts with being more aware of what your fingers, forks, and feet are doing. So things you want your fingers to do are to pick up fresh fruits and vegetables. So drink plenty of water. For men, it's recommended you have 15 cups a day. For women, it's 11 to 12. If you preferred flavored waters, it's healthier to flavor it yourself with natural or natural ingredients such as real fruit, cucumber, and or mint. Do not let your fingers pick up tobacco products. Also, limit your alcohol consumption. Certain meats can be carcinogenic or cancer-causing. If we look at page 12, you will see that there are 3 categories of meat that can cause cancer in humans. So these are processed meats, so cured, smoked, or preserved with nitrates or nitrites. And unfortunately, this can be a lot of lunch meats that you get at the grocery store. Red meat, which is unprocessed mammal muscle, such as beef, bison, mutton, lamb, goat, and veal. And then you also have to consider how you're cooking the meat. So exposure to high temperatures and over a flame can produce carcinogenic chemicals. So is anyone familiar with the food pyramid? I remember when I was a kid, the food pyramid is what they would show us at school to represent how many types of foods were healthy and to give us dietary guidelines. This is a similar concept to keep in mind. The dietary guidelines provide science-based advice on what to eat and drink to promote health, reduce the risk of cancer, chronic diseases, and meet nutrient needs. So it's recommended that you limit your sugar, saturated fat, and sodium. Also in your diet, try to add things like dark green vegetables like spinach and diversify the colors of your plate. So not only would you go for dark greens like spinach, you'd also want something red like peppers, something orange like carrots, and your plate should be colorful. And make sure you're eating good fruits, whole grains, and dairy that is fat-free or low fat. And next is being aware of what your feet are doing. So we're going to talk a lot about the advantages of being physically active because there are so many. So, being physically active helps maintain appropriate weight. heart disease risk. It helps lower the risk of high blood pressure and diabetes. It promotes bone, muscle, and joint health. It promotes your psychological well-being and reduces your chance of premature death. So in order to see these benefits, it's recommended you have at least 2.5 hours a week of moderate activity and an hour and 15 minutes a week of vigorous activity. You can break that down to 30 minutes a day. On page 15, you'll see a list of some examples of moderate intensity activity. And for vigorous, really is about finding something you like and can incorporate into your routine. Now we're going to look at page 16. We're going to look at tobacco use and the risk factors associated with it. According to the Cancer Council, 1 in 8 cancer cases are caused by smoking. So 1 in 5 cancer deaths are caused by smoking, and smoking can cause 16 types of cancer. So cigarette smoking is the most common form of tobacco use worldwide. But really, all forms of tobacco are harmful, and there is no safe level of exposure to tobacco. So besides cigarettes, other tobacco exposures can be made with vapes, water pipes, smokeless tobacco products such as dip or snuff, cigars, cigarillos, pipe, BDs, and Kretex. So every time somebody takes a puff of a cigarette, 7,000 chemicals enter their lungs and spread to other parts of their body. In each cigarette, there are 69 different carcinogens causing chemicals. But it's never too late. It's never too late to stop smoking. And the good news is that your body starts to repair itself just 6 hours after the last cigarette. And the risk of smoking will continuously decrease after that. So let's look over on page 18 and talk about some of the statistics for tobacco use here in Georgia. So it's reported that more than 1.5 million Georgians 18 and older smoke cigarettes. Over 300,000 adults use some sort of smokeless tobacco. And currently, tobacco use is the leading preventable cause of death in Georgia. In fact, every year in Georgia, more people die from tobacco-related illnesses than from alcohol, cocaine, heroin, murders, suicide, auto accidents, and fires combined. Doesn't that put things into perspective? So not as if that is not enough, but tobacco use costs the state nearly $3.2 billion in healthcare. So when we take a look at tobacco use in African Americans, research showed that African Americans are more likely to die from smoking-related diseases. So African Americans are more likely to be exposed to secondhand smoke than any other racial or ethnic group, which is a major concern for infants and children. But there is shows that most African Americans that do smoke want to quit. So let's look over on page 12, on page 20. So quitting tobacco, why is it so difficult? Well, there's actually science behind it. So as we talked about earlier, there are chemicals in cigarettes, and one of the chemicals, one of the most prominent ones, is nicotine. So nicotine is an addictive substance, and the compulsive seeking despite its harmful and unwanted consequences. Addiction is mental or so regular use of tobacco leads to this nicotine addiction. So nicotine addiction process is known as the nicotine cycle, in where you smoke, feeling, and then the nicotine level quickly falls off, causing you to crave another dose of nicotine and wait and want another cigarette. So the nicotine cycle and addiction is actually thought to be as addictive as heroin or cocaine. So on page 21, as we can see, there's some more information on harmful chemicals in tobacco products. Of the 6,000 plus chemicals in cigarettes, about 100 of them are known to cause potentially smoking related diseases, known to cause or potentially cause smoking related diseases. So some of these include acetone, ammonia, carbon monoxide, ethanol, methanol, and formaldehyde. And if you recognize, like, acetone is used as nail polish remover and ammonia is a household cleaning product. So the sad thing is that tobacco product manufacturers know all of this, and that's why they are required to put warning labels on their product. So page 22. Now we're going to look at the 3 types of smoke exposure: first, second, and third hand. So most of us are already familiar with first-hand smoke, the smoke that has been inhaled into the lungs directly from a source, and we've talked about the harmful effects of that. There's also second and the lesser known third-hand smoke that affects both the smoker and the non-smoker. So as you see in the picture, there is smoke, the smoker's inhaling coming off of her burning cigarette, but there's also smoke from someone's cigarette out the window that she's inhaling. Health effects for both the smoker and non-smoker are increased risk of high blood pressure, heart attack, lung problems, and lung cancer, damage to eyes. Kids exposed to secondhand smoke get more ear infections, respiratory infections, and are at higher risk from dying from sudden infant death syndrome. The third-hand smoke is the residual nicotine and tobacco partials that accumulate on surfaces such as furniture and clothing. Give this one as much thought. These residual particles are known to cause the same increased health concerns and risk as secondhand smoke. Unfortunately, these residual tobacco particles are very difficult to remove. They attach to surfaces for months after initial exposure. And this is where children are more and most at risk. So moving on to page 23. Tobacco has firmly established its links to at least 12 different types of cancer, and you can see the list here. So let's look for a minute on how smoking is related to cancer. According to the Center for Disease Control and Prevention, poisons in cigarette smoke can weaken the immune system, making it harder to kill cancer cells. The cancer cells keep growing without being stopped. Poison in tobacco smoke can damage or change the cell's DNA. And when the DNA is damaged, a cell can begin growing out of control and create a cancerous tumor. And smoking can cause cancer almost everywhere in your body. The cancer who smoke are also more likely to die from disease than non-smokers. So now you may be asking, can smoking-related cancers be prevented? And the answer is yes. As we can see on page 24, we have some bullet points. It lowers the risk for cancers of the lung, mouth, throat, esophagus, and larynx. Within 5 years of quitting, your chance of getting cancer of the mouth, throat, esophagus, and bladder is cut in half. Years after you quit smoking, your risk of dying from lung cancer drops by half. When you smoked, 1 of every 3 cancer deaths in the US. The smoking cessation represents the most single important thing people who smoke can do to enhance the length and quality of their lives. So let's talk some good news. 2 weeks to 3 months after quitting, your circulation improves and your lung function increases. After 10 years after quitting, your risk of cancers of the mouth, throat, and voice box is cut in half, like we just mentioned. And 10 years after quitting, your risk of lung cancer is about half of a person who's still smoking. And your risk of cancer of the bladder, esophagus, and kidney decreases. Other benefits you'll notice right away, like you save money on You save money because you had the money that you would have spent on tobacco. Food tastes better. Breath, hair, and clothes smell better. You would notice your teeth and fingernails stop yellowing. Quitting stops the damage and effects of tobacco on how you look, such as premature aging and wrinkling of your skin, gum disease, and tooth loss. And generally, you will look, and after hearing all of this, if you're ready to quit, let's talk about some steps you can take now. So on page 27, we have a make a plan to quit. There's no one right way to quit tobacco, but there are some important steps that you can take to help ensure success. So on the next few pages, we've listed some steps that can help you or a loved one in trying to quit. So I want you to think about why you're quitting and why you want to quit. I need you to write a few examples of why and make it personal. Write it down and look at it every time you want to smoke. Once you know your reasons to quit, at a quit day and start to gather tools to help you have a successful quit journey. The big tool to use is to increase your chances of quitting. To increase your chances of quitting is support. Contact family, friends, community. Support is a key part of your plan to quit. So along with this, there's some quit programs that we have listed here for you. There's also counseling and other types of emotional support and medications. It's best to talk to your doctor about the plan which is right for you. If you would like any more information about these programs, especially the Georgia Cancer Center Tobacco System, please let us know. We would be more than happy to get it for you. So thank you all for being with me today. Next week or next video, we will look at some of the myths about cancer and cancer treatment and some of the concerns people have about both. So you do have a little bit of homework to work on this week. For this session is in the back of the manual, and this shouldn't take too long for you to complete. And you can just keep them for your personal knowledge. Thank you so much. I had fun guiding you all today, and I hope you come to our next session. Bye.